Okay, so I believe we're live. We'll give it a few seconds because sometimes it's just a little bit of a time lapse. Okay, we'll start. So Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Greetings of peace to everyone that's watching now, as well as those that may be watching later on. My name is Afaf Nasher. I'm the Executive Director for CARE New York. By now, everyone should know who CARE New York is, but in case you don't, CARE New York is the New York chapter for the Council on American Islamic Relations. We are your civil rights organization catering mainly to the Muslim American community. Of course, we don't discriminate against anyone, so anyone with an issue is permitted to call or to check us out on our website. We are still fully operational. I understand social distancing is in effect, hence the webinars. But anyone that needs to contact us should feel free to do so. We're checking our voicemails daily. Our number is 646-665-7599. And our email, well, there are several emails, but mainly you can contact info, I-N-F-O, at ny.care.com. That's info@ny.car.com. All right, so today's coronavirus webinar essentially goes back to what city resources are available to us, right? We want to understand where we are now, and by city, I mean New York City, of course, and we want to know what the latest updates are coming in from the city, and what updates do our community members have to access. And I think those are really two critical points. We watch a lot of news. There's a lot of sources out there. Sometimes they're conflicting. So today I have with me two members of our own community, the Muslim American community, who actually work in city government, Brother Ayyad and Brother Sulaiman, and I'll allow each of them to introduce themselves as well as where they work, and then we'll hop right into the information. So welcome, Brother Ayyad, Brother Sulaiman. I guess we'll begin with you, Brother Sulaiman. I saw you unmuted yourself, so please feel free.
Yeah. So, assalamu alaikum everyone. As Afaf mentioned, my name is Brother Sulaiman. I work for the Mayor's Community Affairs Unit, specifically on the faith and community partnership. So my main focus is Staten Island, but also New York City with the Muslim community with my amazing colleague, Brother Mamadou, who is our new Muslim liaison.
And Brother Ayyad.
All right, assalamu alaikum everyone. Thank you so much, Sister Afaf and the CARE family for hosting this webinar and for having us also on this webinar. My name is Ayyad. I work for the Mayor Office of Immigrant Affairs. It's one of the many agencies in city government that's dedicated to immigrant communities across New York City, and they're advocates in City Hall. And I am a neighborhood organizer, and my turf is Brooklyn, Astoria, Queens, and the Bronx, in some parts of the Bronx, Little Yemen. And so, yeah.
So, mashallah, I'm just smiling because of the way you said it, my turf, right? I mean, such a New York thing. And I gotta say, as somebody who's lived in New York all my life, guys, I mean, the streets being as quiet as they are, I mean, come on, we're the city that never sleeps. And apparently, you know, they're putting us to bed, right? At least the pandemic is. And for now, that's what we need to do. And it's really important that people abide by those rules for the safety of all New Yorkers throughout the entire boroughs. We're a densely populated city, of course. So let me give each of you an opportunity to push us through some facts and updates of where we are now. Brother Sulaiman, since we started with you, whatever updates that you feel are the most pertinent to give our community members with regards to where we are with the pandemic and what those regulations are, and then Ayyad, you can fill in any gaps that you feel are important as well.
Yeah, so again, Jazakallah for CARE and Sister Afaf for hosting us. So what I will do is I'll just give obviously the brief overview, and Brother Ayyad is actually going to give some really amazing information on services that the city can provide. So first of all, I just want to start out by giving some of the updated numbers that came out last night, the updated numbers as of last night, with positive cases of coronavirus. So then this is just New York City, not the state. So as of last night, we have about 64,900 positive cases. I'm just going to give the estimate number just so everybody can remember, and about 2,400 fatalities as of last night. And breaking down based off boroughs, that's about 12,700 in the Bronx, 17,500 in Brooklyn, 21,700 in Queens, 3,600 in Staten Island. So those are the breakdowns as of yesterday. On the bright side, somewhat of a bright side, we have the lowest amount of deaths as of yesterday from coronavirus. So you might hear like Governor Cuomo or other elected officials saying that we might have passed the apex. And in other words, if people who don't know what apex is, means like we're reaching the top max of this horrible pandemic. We're hopeful, but we're also expecting the next week to 2 to 3 weeks to be for us to reach that apex. So, and then we'll hopefully after that we'll start seeing a huge decline in like positive cases and people and an increase of people being you know becoming healthier after they've contracted COVID. So making the law that we did pass the apex, but we're also very keeping our minds open that we might reach that point within the next couple of weeks. So this is where social distancing and staying home comes into play. And speaking of social distance, that's like the number one rule that we see us as Muslim leaders, as city officials, as NYPD, as EMT workers, doctors, just everybody saying how we need to all practice social distancing. And that's pretty much been the number one rule that us at the mayor's office has been trying to really tell people to do. So what is social distancing? What are like the basic rules? In rule number one means staying home. If you don't need to leave the house, don't leave. Stay home. Spend some time with your family. This is also, I think people are saying in a quarantine, like I think a great meme coming out is quarantine or Quran time. It's a great time to catch up on some of those things. Staying away from people so you don't contract the coronavirus. If you might have it and you're not showing symptoms, it prevents you from spreading it to others. And it's also keeping your family safe. All of us have loved ones who are in that category of what is most likely going to be affected by coronavirus, and that's kids, little infants, younger age kids, and most of our elderly parents who are very old, and actually have pre-existing conditions. They're the most likely to be affected by coronavirus. And lately we're starting to see healthier people being affected. So
Right.
it's not it doesn't discriminate. And a lot of people, a lot of doctors and the WHO are saying that this is a very like active and it mutates very quickly. So and then this virus mutates very quickly. So it could affect everybody at one point. So we just want to make sure that everybody stays home and tries to prevent the spread of it, and that's what we call flattening the curve. As a lot of people will be hearing in the news media. And also,
what I've been seeing, Brother Sulaiman, is even when people do have to go out, and perhaps each of you guys have seen this as well, even for the supermarkets, a lot of mega stores have been implementing social distancing inside the store. So you've seen people waiting outside and they allow people inside little by little, right? So that people can maintain distance, which I think has been a bit effective. And I also just want to remind people that, there's an immense amount of city resources that's being expended that would have otherwise been expended, in the programs that we have come to not only benefit from, but to expect. And now with these resources coming in, obviously from the federal government, but also for city resources as well, it's in our interest to make sure health-wise, economic-wise, that everybody is doing their part, because it's not just about, hey, I'm young, I don't have any illnesses, but rather about who am I potentially spreading this to? And can I be a part of the solution, considering the fact that for every one person, from what I understand, the doctors, 2.5 people, rapidly infect, 2.5 people for every one person that has it. But Brother Sulaiman, let me just, with those numbers that you gave, 64,900 obviously is really a large number. Having said that, we know that not everybody is getting tested, even if they're showing symptoms. So in all reality, what we're really looking at is potentially a number much higher than that. Would you agree?
Yeah. So another sad reality is that we don't have enough test kits to really test everybody. So that number is definitely much higher. And these are just numbers that we are getting because people are getting tested. The folks who are getting tested, these are the numbers. We're seeing about close to 50 to 75% of folks who do get tested do test positive. But I might have it, you might have it, but Ayyad might have it. But the thing is, we're not showing symptoms or anything like that. But alhamdulillah, we're staying healthy, and coronavirus only stays in a person for almost 2 weeks. So we're hoping that's what we're encouraging. If you do show symptoms, just stay indoors for 2 weeks. Don't go outside, because there's that 2 week period where it's always a hit. It's, you know, it's always like a healing
Incubation
period.
period. Yeah.
Exactly. So, yeah, and you know, it's just sad. So, and also, I'm pretty sure this question might come up, like, how do you get tested? Um, and this is like the position of the city, and it's only because we're very, very limited in the test kits, and we want to use it just for very you know, um, immediate responses, meaning that if someone's really like very, very sick, that's when we want to test the person.
All right.
So
So I'm going to hold you off right there. I'm going to let Brother Ayad jump in with regards to any other information he wants, and then we're going to come back to the testing because that's really important. Let's cover that with the resources that are available to people when we hit, the medical issues that I think hospitals are facing with that people who want to get tested. Is that all right? Okay, Brother Ayad, you've heard him saying the incubation period, social distancing, that's what the city is telling us. You've heard the latest updates with the numbers, the fatalities. And I know that some of those high fatalities are in your turf, as you've described them, right? What can you add with regards to those updates? What are you hearing? And then we'll jump into resources.
I want to, just add on to that, that these, services or what we're seeing is available in many languages, including the Arabic language, including Hindi, Bengali, many other languages. And, the primary website that people could visit is, nyc.gov/coronavirus. And that's where you see all the facts, fact sheet. That's where you see the instructions from the CDC and also New York City Department of Health by, ways to wash your hands, on how to prevent the spread of the disease, as well as other resources available for all New Yorkers, regardless of immigration status. And we will get, in depth to that on what available resources and what about healthcare, what about access to care, inshallah, throughout this webinar, as well as food assistance programs, for available for all New Yorkers, and recent updates from Department of Education for their locations when it comes to food as well for students. So we'll touch up on that, but I just want to clear, add on to that there's a website dedicated to COVID-19 or coronavirus, and it's a city website. It's legit, so people could use it. Because I know there has been a significant amount of misinformation, and that's creating more panic and fear. And we don't want that. It's okay to be afraid from this virus. We are all afraid. I think we could agree. But at the same time, there's facts in place that we need to follow and, to prevent the spread of that virus. And we could do that as, New Yorkers, but we just need to follow instructions.
And just for clarification, so I know we're talking about social distancing. I know the mayor had suggested that, we don't have enough masks to go around. So he suggested that people use other materials to cover themselves as well when they do have to go out. So that's also in place. Please correct me if I'm wrong on anything that I say. But I also wanted to touch upon, and either one of you can speak to this, there are businesses that are still open. What are the rules and guidelines and regulations with regards to who gets to stay open and who shouldn't be open, and how they should be controlling the influx and populations of people? How are we maintaining social distances when it comes to those businesses that are permitted to be open?
Brother Sulaiman, if you want to, stop me at any time, but I know that there's an executive order, both from the governor and the mayor of New York, that, or all essential services remain open. That's such as groceries, bodegas, and healthcare providers, other, and pharmacies, of course, but, companies, regular, I guess, real estate offices or other offices, should be closed. And work from home. We encourage everyone to stay at home and work from home if they can. But if they're essential workers, then there's transportation that is still functioning, of course. And but we still advise people to remain 6 feet away and more if that's possible. When it comes to essential bodegas, for instance, like you said, Sister Afaf, earlier, that there has been like, I guess, enforcing this information to keep social distance and limiting access to supermarkets, not more than, like in my neighborhood here in the Bronx, there in our local supermarket, not more than 5 people could enter at each time. And so this is the type of social distancing that we're talking about. And that goes to small bodegas as well. And I know the NYPD, Brother Sulaiman, maybe you could talk about that, have been, given these small bodegas and essential services, flyers on how to keep, navigate this social distancing.
Yeah, I was going to say that essential services is defined through, the state, and people can look at that list. But I wanted also to touch upon what Brother Ayyad said with regards to NYPD and enforcement. Brother Sulaiman, do you have any idea what enforcement is looking like for social distancing when people are out in the streets, in the parks, or even at stores at this point?
Yeah, so most of the social distancing enforcement is actually not just NYPD, is also a combination. We call the social, it's called the Social Distancing Task Force. It's a combination of Department of Health, Department of Buildings, NYPD, FDNY, and just as the Operation of Emergency Management, or Office of Emergency Management. The way that we're enforcing these rules is if we get a 311 call, like let's say the local Western Beef is not really practicing social distancing. We get a 311 call, we would dispatch a police officer or Department of Buildings, a Department of Health inspector there, and to pretty much encourage the store to actually practice social distancing. So it's not like right away we're going to be finding or arresting people. We're not doing that at all. It actually goes against social distancing if you actually think about it. So what we're doing is passing out information. It's like, well, how can you do it? Then if we go there and we see like 100 people just on top of each other, and we're like, okay, we'll have the NYPD will put out loudspeakers and say, we're trying to enforce social distancing. Can you please, keep this, 6 feet apart, and this will stop the spread of coronavirus. We all want to be safe. It's a much more friendlier tone from some of the videos I've heard. So it's just trying to tell people and warning them, look, please keep the distance from apart from each other. So this is really more of the enforcement, more educating, and telling people like, this is for your own good. This is to save not just yourself, but everybody around you, because the person behind you might not, who's actually is practicing social distancing, but the person in front of you just wants to keep coming right on top of you. Like, you don't want that. You don't want to contract coronavirus because you have a mother who's very ill at home. You don't want to take if the person touches you in front of you, and you have the coronavirus, and you're going home taking this to your elderly mother who is in one of those high risk categories, and you don't want that. So you also have to we're pretty much taught to now think about others and yourselves at this point. So that's how the process is going. When we get a 311 call. So if you do see something, call 311 just because we want to break that up. We've heard 311 calls about people playing soccer in the park, playing basketball, but also like some restaurants. I mean, not restaurants, supermarkets that aren't really practicing or enforcing social distancing. Just to call and just call that in. And if a person just calls because they're annoyed by it, we'll check, they'll check it out, and if they see something wrong, they won't even bother with that. So those are some of the basics of the enforcement of social distancing.
Definitely good to know. So what I'd really like to do now is really focus in on those resources. I know that those resources are really vital, especially during this time. And Brother Ayyad, I think you had, begun to mention some of the categories that I'd like to go through. We've been talking about people who are perhaps at higher risk, and sometimes we have portions and populations within our city that are very much marginalized, and we want to make sure that they have the right access to information, right? So why don't we start there? Why don't we start with, I guess, children? If either of you have any information, children can, there's this, in the beginning, there was this misconception that children don't really get the virus, or maybe if they do, they don't really show symptoms, and that's it. But, number one, there have been fatalities of children, so we all have to be watching out for our children, right? But then number two, of course, the city has come down and shut down all public schools, right? I have to say this morning, if either one of you has an update on this, that online learning through Zoom was canceled through public education. Does anybody have information on that and what that's looking like and why and when it's going to resume?
I believe and this is just from like some information I've heard. I have to get that and confirm. I believe we're moving to WebEx. It's a much more secure line, much more secured. It should, and I can get more information on that later on. But from my information, I believe we're all switching over to WebEx instead of using Zoom.
Okay, so you think that it's the switchover process. And I know that in the news, there's been a lot of hacking into Zoom as of late, and that could be very problematic when you have a child audience. Is there anything that either one of you want to talk about with regards to resources specifically for children? I know, for example, there have been school lunches. Ayyad, would you like to talk about that?
So yeah, so there are some resources from the Department of Education that includes like iPads and electronic devices for those who cannot afford or don't have, and of course there's a link and there's a form online, or if you go to the Department of Education site, it's available there to apply and it will be delivered. I actually did it for my brother who's a ninth grader, a high school student, and they sent him an iPad. There's also available in 400 schools across the city for I guess meals, three meals for students. Yeah.
Yeah, so breakfast, lunch, and then a package to dinner, right? Correct. And I just want to say for people that don't know, if they've never been to the Department of Education's website, I really think it's actually one of the better websites of the city. It's very clear in my mind, at least the times that I've had to gather information. And I had to correct me if I'm wrong, but they also have it in multiple languages. So there's a lot of languages that can be accessed with the Department of Education.
That's correct.
Okay, so then, from children, then let's go to other marginalized communities and access programs. Why don't we talk about our immigrant population? So sometimes immigrants are the last ones to come forward. They hesitate sometimes to go and seek medical assistance, right? What is the city doing to make sure that they're fully protected as much as everyone else? And this is immigrants that are both here and that are documented, right? But simply don't have the language access or whatever it is that they need. And then on the flip side of that, you have also undocumented immigrants as well, who really need to know that they're also protected, especially during this serious crisis.
Sure, I could jump on that. So getting healthcare or getting care or treatment for COVID-19 will not make anyone a public charge, especially for green card holders. I know there's been how the federal government has been handling the case on public charge, and that has caused a lot of fear, and especially getting treatment for that. I just want to assure you, if you're here within the 5 boroughs, that would not have any problem with getting access to treatment or a test for COVID-19, and it does not hurt you when you apply in the for citizenship in the future. Also, you will not hurt.
You're a citizen. Do they ask about your immigration status even if you do seek these resources?
So, so New York City does not, I mean, the resources is available for all New Yorkers, regardless of, your immigration status, documented or undocumented citizen or green card holder. So our services, when it comes to, getting treatment for COVID-19, is available for all. And of course, beyond that, there's NYC Care, which is a MOIA program that, provides health insurance for the ones for people who are not eligible for a regular health insurance. So we insure. I mean, if you have insurance or not, you will be treated for COVID-19. So no worries when it comes to, in that regards.
Okay. Are there other immigrant resources that you wanted to point out at this point?
So. Yeah, I mean, for sure. So, the health concern or like immigration concern on COVID-19, you don't have to worry about that because it will not hurt your immigration status or, public charge. About the health and well-being for New Yorkers, I think that's very important that we all agree on. You know, we all have mental challenges, and especially during these difficult times. So New York City Health and Hospitals provide care to all New Yorkers, right, regardless of your immigration status. And you could always call 844-692-4692 or 311 to learn more about how to obtain health insurance, or I guess facilitate that process. And as well, there's NYC Well. So if you are feeling stressed or overwhelmed, connect with a trained counselors at NYC Well, which is also another program run by the city. And it's free, it's confidential, it's a helpline available in 200 plus languages. And you could call 888 692-9355, or call 311 and they will connect you or give you the accurate resources or that you need for that program in NYC Well. And of course, about the food, there's multiple resources. There's Food Help NYC, which is a map of free food resources across the city, including food pantries and grab and go meals at NYC schools, available for all children and adults in need. So that's available in more than 400 locations across the city. And there's also like a NYC food delivery assistance. I know Sister Afaf, I reached out to CARE in this for this program. It's it's a new program that the city did funded or started, and it's for those most vulnerable for COVID-19, as well as the elderly and homebound people who cannot afford meals. So the city does provide free delivery and free meals to those who are in need. However, they need to go online and apply, and it's a very easy process. Or you could also call 311. I think that's one of the best resources in city government is 311. Any question you have, any concern, just call 311. But yeah, so it's a very beautiful program. I actually registered someone today, brother here in the Bronx, and it's very, very easy, smooth process. And you could do it alone, but if you can't, you could always contact me or contact CARE, of course. I'm sure they will help you, or call 311 and they will register you online, and you will get 4 meals. So it's up to 8 meals per person, and it's a max of 2 people per household.
So definitely having those meals. I was about to say originally, if you have to go out, that's sort of a little bit counterproductive with regards to the social distancing. Of course, New York City has a humongous population, so delivery to all people would probably not be very practical. I will say, and this is just to throw out at you guys, that I did hear a news report about one local town that was actually using its bus drivers, the school bus drivers, and they were delivering food to those children who needed the food according to their bus route, so that families didn't have to go necessarily to a center or to a school to pick up food, which I thought was really, really smart. The city's already in contract with buses anyway. Maybe bring that, to your bosses, and then think about whether or not that would be feasible, so that kids and families don't have to be on transportation during social distancing rules. There are 2 other populations that I really want to hit, and one of them is the funeral home situation, right? We have an immense problem where we're understanding from people on the ground, as well as news reports, that morgues have sort of been overflowing. There are issues. Initially, there were, orders to not release bodies, I believe, and correct me if I'm wrong, and people weren't able to bury their dead, and so bodies were being stored. But as those numbers grew, they began releasing bodies. What are the latest regulations? What do people need to know with regards to paying their respects? And it's a sensitive situation, because obviously this is it's already stressful time, but when you are in that emotional state in which you've lost a loved one, you want to be consoled by family members, by friends and whatnot, but social distancing is prohibiting it. And then you have the issue of the funeral homes. So please give us an update on where we are. How is the city proceeding with those rules and regulations?
Yeah, so I could take that. So yeah, funeral services and passing of loved ones with COVID-19 has been like pretty much a big issue the last couple of weeks. It's something I never expected my job to really be talking about this kind of thing, but it's a situation that we're in. So I know like we've been getting some. I myself have been getting some questions about hospitals that have been preventing bodies to be released. If that is the case, that shouldn't be happening. So what I would encourage is maybe we could set up something through care. If they give you a call and then you can forward that information to me, we'll try to get that moving as fast as possible. And you know, as you guys hear on the news, the morgues are overloaded right now. It's really really sad, and it's something that we wish no one has ever have to really experience. You probably have seen some hospitals have temporary morgues, which are like the trailers with the AC cooling of refrigerated cooling, which some of the hospitals are using as to temporarily hold the bodies, and that also including some of our Muslim funeral services. I mean, they are very overwhelmed.
Right.
I've been in touch with a few, and I could only feel their pain, and it's just really sad that we're like not moving as fast as possible. Try to get the Islamic ruling of trying to bury them as quickly as possible. It's just they're very overwhelmed. And like the system is very overwhelmed. I've had to help folk, families whose loved one passed away from not COVID related,
Are
symptoms.
they experiencing the same problems, or is it that the bodies of those that have passed away, inna lillahi wa inna ilayhi raji'un, those that have passed away from COVID-19, are you seeing issues with the release of bodies in both situations, or just the COVID-19 situation?
It's not really the release of bodies. It's more of trying to get them processed through the DOH system. So I believe what the process is, and I could be wrong on this, is that once a person passes, the coroner's office has to determine what the cause of death was. And this could just be like them visiting the home or just the hospital, and the doctor could say, okay, they passed from COVID-19. Oh, this person had a heart attack. This person died of just old age or sicknesses or some other reason. And then once that's done, the Department of Health sends the death certificate, and then that's presented to the funeral, and that's when the funeral home gets involved of taking the body to the funeral home, doing the Islamic body, washing the body, and then the shrouding, and then taking care of the burial process. That's how, and I'm probably oversimplifying it. That's how I know that the system is supposed to be going forward with. If there is an issue with releasing the body, that shouldn't be an issue. We want to try to free up as much space as possible. And it might take some time. I mean, I wish this isn't the case, but we're just so overwhelmed with the amount of deaths that are happening and the rate that it's happening, that just trying to process the body and try to get it released as early as fast as possible. It shouldn't take more than a day. If it does, please just forward the information to me or Ayyad, and we'll try to take care of it from the city's perspective. Our team at the city is really trying to make sure that we get this, because it is a very sensitive topic, and we want to make sure that all religious denominations are actually, we're respecting everybody's, the religious rulings of burying the person. So we want to try to get this done as quickly as possible. If there is an issue, please let us know. We'll try to see what we can do, try to speed that up. But we just want to let folks know that there is an overload on the system, the Department of Health system, which is kind of delaying the process of when the person does pass to getting into the funeral home. And there's also backlogs within the funeral home services. I know some funeral home services only has space for like 4 bodies at a time. Sometimes they're getting calls, hey, we got 10 bodies. How I know 10 people passed away. How do we get? I mean, we need to get them, and they want to use XYZ services, Muslim services, right? So they are trying to come with deal with the overwhelming incoming of of debts coming in. So it's literally everybody just backed up. We're trying to move as fast as possible. We just ask people to we'll try to move as fast as possible, inshallah. But there is also a backlog within the system.
So two questions on that, and either one of you could answer. Number one is, what about funding for those that can't afford a burial? Is New York City providing any funding in that regard, either to the funeral home or to the family to cover expenses? Number one. And the second question is once the body is released and it's prepared and it's ready to be buried, does social distancing apply? What kind of regulations are being imposed in that regard?
Yeah, so HRA does have a program where they could actually pay for certain funeral services.
And for our viewers, HRA is
Health resources. Correct if I'm wrong. I always mess up the acronyms. It's the Health Resources Administration.
That's what I'm thinking.
Right. Okay. Yeah. It's just so many acronyms that we have in the city. But yeah, so they have a. We'll actually send a link to Sister Alpha so you guys can share it within the CARE social media and your network. So they do help pay for some funeral services. That includes like the actual funerals, homes, and everything like that. Also, we do recommend, the community also try to do some fundraising. Obviously, being a city and we're already overwhelmed, I'm pretty sure they already have a huge backlog. I haven't checked in yet, but I'm pretty sure they have a backlog as well. So, it'll be better if maybe, the Muslim community comes together and actually has a fund where the funeral service could go and tap into to, maybe speed up the process, and I know like funding has been an issue with burial processes because I believe Long Island, they're charging ridiculous amount just for burying a person versus New Jersey. So there's a lot of expenses that comes with that.
Well, I think certainly expanded funding is something that you guys perhaps need to speak about internally with the city, and expediting the process for funding, because the sooner that funding is expedited, the sooner the process for burial can go along, the sooner we free up our funeral homes and our morgues. So I know as a community member, but also as an advocate, I would really ask each of you to please look into expanding that program. We know that resources are tight. Having said that, this is just one of those essential services where you can't have bodies sitting there, religious reasons and health reasons. And then I think, Brother Ayyad, was there anything you wanted to add to that? I'm guessing, and this is what I've heard, that even during the burial process, social distancing applies, right? So they're asking people not to congregate in large numbers. And, of course, I'm not an imam, but obviously our du'as are always with those that have passed away, but to the extent of helping to prevent more bodies from being buried, and nothing happens without Allah's will. And we ask and we pray that everyone stays healthy. But to that extent, we should practice social distancing, even as we're congregating and praying for the deceased. And then Brother Ayyad, I'll allow you to say anything else that you wanted to more on the funeral homes, if there was. But then I also wanted to touch on our elderly population in elder homes, because elder homes, as we've seen in the news, have also been one of those high-risk places where there's been a lot of, unfortunately, COVID-19 spread. What are the rules there, if either of you can speak to that?
So for the funerals, I just want to emphasize the importance of social distancing. And we do recommend only immediate family of the person who passed to attend the funeral, and for very small numbers, and for the elderly or senior homes, I think the city is have sent guidelines for the workers in those centers on how to prevent the exposed COVID-19, as well as there has been one of my colleagues shared from Staten Island that they do check people, including the workers who go into those senior citizens homes, but there's no visits as of now, and that
immediate family, correct?
So immediate family, correct me if I'm wrong, please, Sulaiman, but there's no visits, and there has been also, available resources to contact their family, via like Skype or FaceTime, and if it's something urgent, then they will be allowed, but everyone who goes into those centers are being, screened for temperature and other possibility for COVID-19, I guess, diagnosis.
Well, may Allah protect all of us, each of us individually and collectively. We ask for health. We ask for a renewed spirit. We ask for really the level of responsibility that each of us needs to take on. We're all in this together, every single New Yorker of every faith, of those that are not practicing any faith. This is something that impacts us all as one family. And so we thank you both for giving us some time. I'll give either of you or each of you really an opportunity to speak on anything else that you want to speak on with regards to available resources, which you believe is important. I know that both of you will be sending me links and other information that we can post up. We'll be sure to do that. If those that are listening are having issues with funerals, because I know that has been an issue in our community, please do contact us. We'll forward those communications to these brothers who will then, direct things internally from the city onward to help you expedite, inshallah. And then I think for both of you, please, finish up with any resources, but also just convey, and this is something that I like to ask because we are an Islamic organization. We are speaking mainly to the Muslim community, and we really appreciate both of you doing what you're doing. We know that a lot of city folks, including those in law enforcement and first responders, are putting themselves at risk, and especially, of course, healthcare workers. But we pray for all of you, and I'd really like to sort of know how it is that perhaps your Islamic identity, your cultural identity helps you to serve, especially during this time, right? Because there's a lot going on, and the Muslim community is pretty big here in New York City. So how does that push you forward with making sure that your community's needs are taken care of? So I think, Ayyad, we'll start with you, and then we'll go to Brother Sulaiman, and we'll give him the last word.
And thank you so much for this question. I like to think of this as like in a general sense, subhanAllah, our entire sunnah relates to how we, help others and how to, uplift one another. And that's our, for me and Sulaiman could agree on this. This is, and you, Sister Afaf, in your profession as a lawyer. And, it's it's the primary drive that encourage us, or I guess inspire us to continue that, serve in our community and all communities. And I like to always think of this, hadith, and it was related on the authority of Abu Huraira radiallahu anh, that the Prophet sallallahu alaihi wasallam said, whoever relieves from a believer some grief pertaining to this world, Allah will relieve from him some grief pertaining of the hereafter. And so it's not just, I do this work, to uplift my community as well as be the voice of my community in city government and all communities, all immigrant communities, because I think, we have been, underestimated for a very long time. And, it's time for us to, I guess, balance that equality of, power, because, without the constituency in New York City, we won't, who are we serving? So, I like to think of that, and, we continue to follow the sunnah, or I continue to follow the sunnah, and that's the primary, what's driving me to be motivated increasingly and daily.
Brother Sulaiman.
Just as Brother Ayyad said, one of the best things about being Muslim and working in this position is that we get to bring Islam to government. That's actually a great thing. My mentor, Dr. Sarah Said, which everybody knows is probably one of the best or perfect person to really mirror of like what it means to be a good practicing ambassador of Islam at city government. So she definitely inspired me without a doubt. Seeing the work that she did for the community, just bringing resources and actually bringing our concerns to the forefront, and me being in the same unit as working with her and doing the same exact thing actually gives me a lot of happiness. I'm actually making sure that my community, the voices of my community are being heard. the Muslim community. And sometimes it goes beyond that. Like I have folks from other communities that are asking me, say, hey, can you bring this issue up? Can you help me with this? It's an amazing, really amazing opportunity, and place to really know that I'm not going to work just for a paycheck. I'm going to work to actually change people's lives and actually help people. And this goes back to what it really means to being Muslim, is representing like our deen in the forefront. So that's pretty much like our drive to really keep doing this. I mean, I'm pretty sure me and Ayyad, we've been working like probably 18 hours a day the past 2 to 3 weeks. But it also, this also really humbles us because we're at home now. So we're able to like at least catch some time to read Quran, to pray. I catch up on my really cool Islamic superhero shows, Ertugrul, Omar series. So it gives some time to really reflect on ourselves and the work that we're doing, and really recenter our focus that that we're doing this not just for the community, but also for Allah subhanahu wa ta'ala at the end of the day.
Alhamdulillah. Alhamdulillah for the opportunity. I mean, those 18-hour work days are certainly nothing that is very far for me and our team members here at CARE New York as well. That's almost standard for me. But having said that, it is a blessing and an opportunity. And I thank you both for inspiring me and everyone else who may be listening and reminding us that it's not just about a paycheck. It's about something far greater. And when you hear it from young folks like yourself, it really brings me personally a lot of joy and a lot of hope to see that your eyes are on the prize, which is service and humanity is something that goes far beyond, this world, but something that will hopefully come and weigh heavily for all of our scales when we're in front of Allah subhanahu wa ta'ala, in front of God. So it is a blessing. It is a privilege. I thank you both for your time. Those resources are really important. We talked about food, we talked about healthcare, we talked about immigrant issues, we talked about burials, all really essential to living our life on a daily basis. We're talking about really practical necessities of life and what this pandemic has given us in terms of challenges. And we will definitely be posting those resources. If you think of anything else, don't hesitate. We'll push it to the community and we'll be in touch soon. Keep healthy, keep safe. Jazakumullah khairan both.
Thank you.
That's all I got.
Allah khair.
Assalamu alaikum.
Alaikum salam.